what do you think, is the burden rising, regressing, same? And what are the important risks? What are the risk factors? Why the heart attack is more in Indians, and that too in young more as compared to elderly people? Dr. Ashok Seth, sir.
India is the world capital of not just lifestyle disorders, but of heart disease. 50% of the deaths from heart attacks across the world happen in this country. And if we actually compare it to the West, we are 200 times, twice more prone than white Caucasians, 6 times more prone than Chinese, and 20 times more prone than Japanese to develop coronary artery disease. So we, as a race, as Indians, are more predisposed to develop coronary artery disease. And the worst fact is that over the last 30 years, and you said, yes, I've been practicing at the helm of cardiology and led this field for the last 30 years in this country. Last 30 years itself has shown a 3-fold rise in the presence of heart disease in this country, in the prevalence of heart disease in the country, both in urban areas as well as rural areas. Then when we look at the number of deaths, nearly 1 in 4 deaths in this country happen due to cardiovascular disease, of which majority are heart disease itself. So it's the number 1 killer in this country and the number 1 killer in the world, but India is the capital of heart attacks and heart disease. The question comes in, why is this happening? We've also seen that there's been at least a 200% increase in heart attacks in the young in this country in the last 15 years. Very frightening figures. We've also seen that 50% of the deaths from heart disease are in people less than 70 in the useful time of their lives. Another frightening figure. And when you translocate this to the fact that we are a young nation, we're a young population, and if we have such increasing evidence of heart disease, then what is our status going to be in 20 and 30 years when this population even grows older and gets more heart attacks? So it is worrying. Now coming to the risk factors, why are we so predisposed, why are we rising? Now we know that there are certain risk factors which we call are unmodifiable, and that's the fact that males will get more heart attacks than women. The fact that if there's a strong family history and our parents, the first degree relatives, which mean our parents, mother or father, brothers, sisters have had heart attacks, then we will get a higher chance of having a heart attack. That's something which we can't change. But there are certain important diseases, like you just explained, which exist in India far more than anywhere in the world, which is diabetes, which is hypertension, which is what we call central obesity or metabolic syndrome, which are peculiar to this country. So we know that hypertension practically exists in 25 to 30% of the population, so does diabetes. And the central obesity, which you have a great interest in yourself, Dr. H.K. Chopra, is this special syndrome of central obesity where our stomachs are larger than the other obesity which exists in the world, where sometimes the hips are larger than the stomach itself, along with the fact that we have impaired glucose tolerance, we have raised triglycerides, and we have low HDL cholesterol, a typical feature in this Asia-Pacific region, which predisposes. Now talking about the risk factors, you yourself have had a great interest in risk factors for coronary artery disease, Dr. Chopra. While we talk about the unmodifiable risk factors, males are more prone to get heart attacks than women, firstly. And the second aspect is that if there's a strong family history, which means somebody which is very close to you, your mother, your father, your first degree relative, your sister, your brother, has had a heart attack, then you've got a higher chance of having a heart attack. The second aspect is the disease processes which predispose to heart attack, which are higher in Indians. Diabetes, hypertension are 2 very existent disease processes that you mentioned yourself, which exist in nearly 25 to 30% of the Indian population, far more than anywhere in the West. They predispose to heart attacks, and it is utmost importance for us to keep them under control. And the third disease process, which we call, is something called a metabolic syndrome, in which you've had a great interest, which is we as Indians have a greater degree of abdominal obesity associated with impaired glucose tolerance, as we call it, high insulin levels, and we then have also raised triglycerides and low HDL cholesterol. That in itself predisposes to coronary artery disease and heart attacks, and it becomes important for us to correct that obesity. We also have bad habits, and these very important bad habits cause heart attacks and or heart disease in itself. And those bad habits are smoking. The number one, I would say, worst habit which we can avoid and which can stop us having coronary artery disease or heart attacks. Obesity. If we have a lifestyle which is sedentary and we develop or become overweight, that itself predisposes to heart disease and heart attacks. And then, of course, bad eating habits. That's one of the very important. There are two other environmental factors which are very important, which is that we have psychosocial stress. We live under circumstances where we're chasing time every day, where we have other stresses happening upon ourselves, which can predispose to having heart attacks. And of course, let us not forget that there's an increasing pollution, which is resulting in greater damage to our heart arteries and resulting in heart attack. That actually sums up everything. But again, one important fact I would emphasize, the modifiable risk factors, which is smoking, which is obesity, which is bad eating habits, which is lack of exercise, and which is not controlling your diseases of hypertension and diabetes, are all within our hands, and we can therefore prevent this bad disease from affecting us and from killing us.